Okay, so in this scenario, I'm eating at a restaurant and the lady at the table across from me begins to choke and cough forcefully. So the first thing I'm gonna do is I'm gonna check the scene, make sure it's safe to intervene. Once I see that the scene is safe, I'm gonna check the victim, realize that if they're realize they're choking. The universal sign for choking is someone with their hands like this around their throat. Then I'm first going to encourage the victim to cough forcefully, trying to cough the object up. If that doesn't work, I first gain consent to start performing abdominal thrusts. To do abdominal thrusts, you stand behind the person, ball one fist up, place it kind of around their waist, right at the belly button. I take the other hand, place it flat over the clenched fist, and then just kind of squeeze in and kind of upwards on the stomach area to try and see if you can forcefully push the object up. You do this up to 5 times, so you kind of grab it like this and then push up like this, up to 5 times. If the person goes unconscious, you lower them to the floor. Then have a bystander at the restaurant or wherever you're at call 911 to check for the airway. You do a head tilt chin lift to see if you can see what's going on in the windpipe. If you cannot find the object and fish it out, you start with 2 rescue breaths like this. You start CPR by doing 30 compressions. Same thing, hand over the other, heel of the palm on the sternum. Okay, so after 30 chest compressions, I do 2 more rescue breaths. The object falls out. I fish it out of their mouth. Then the next thing I do is I check the ABCs. So airway, breathing, circulation, severe bleeding. I don't see any severe bleeding. I check their pulse. They have no pulse. As far as airway, like this. Looking, feeling, and hearing for breathing. And then as far as airway, the airway is clear now that the object's out of the way. So I then continue CPR with no signs of life. I continue CPR with 2 more rescue breaths and 30 more compressions. And you continue that for 5 cycles unless they show signs of life or someone higher medically trained shows up to help.